This is the Adventech.
The Adventech 2 machine that I've used. It has two channels, two controls on top. We use one at a time. When you open the case, you find a battery and you find two controls. The pulse duration should be set at maximum, it's more comfortable, and the pulse rate at maximum, about 120 cycles per second or 120 hertz. The probes I use are brass rods that have been covered by shrink tubing. The one end on the left has been crimped so that it tightly fits the connector from the TENS machine. On the right end, we take Q-tips or their equivalent and slide them into the brass tubing. You see the above one, the Q-tip is only partially in, the bottom one is completely in. These are then wet so that they serve as contacts on the tissue. Here we're clipping the vibraject onto our syringe. It may only be placebo, but patients seem to like it. It seems to cut down the discomfort, or at least distract from the discomfort of the injection. It's normally handed to me with the unit already turned on. Here the probes are in place. I reach over to the TENS machine and turn it up and tell the patient, give me an ah when you feel the first signal, and then give me a second ah when it's very strong. Once I get the second ah, I take the syringe and go in and pierce the tissue and of course inject slowly so that I don't cause any pain during injection. You can see how we can slide the probes around, retract into tissues to give anteriors. We can work in the posterior up above this way. We can infiltrate the lower anterior. We can even go up into the palate, although you'd never lift the probes off like this. You'd shut the machine off. But holding on either side of where the tissue is going to be pierced by the needle, either in the incisive papilla area or in the posterior area, you can give any injection painlessly if you hold the current at a high enough level.